Hello everyone, my name is Jose Tabohara, and I'll be presenting to you a proposal for coronavirus, or better yet known as COVID-19, for a relief program in Weatherford County in Texas. This community/county has been improving its healthcare facilities within the past 15 years, and it's still continued to be growing since this day. This city is considered a small base based on the 2020 reports showing a population of 38,722 people. The situation is with the outbreak of COVID-19 during the past 2 years, Weatherford is in need of more healthcare facilities in which they can help provide their community with free vaccinations as well as free testing of the virus. Most of the people in Weatherford, Texas is not vaccinated and unable to get tested because there isn't much medical site in which they are able to go to. Also, some of the people do not have any healthcare insurance, and they fear that they might spend tremendous amount just to get vaccinated or even just get tested. If more clinics or medical facilities are built, we would have staff on hand to educate the people living in Weatherford, Texas about the virus, as well as helping them to get coverage on healthcare insurance. The main factor that led up to needing more healthcare facilities is the outbreak of COVID-19. The outbreak took place in December of 2019 in Wuhan, China. COVID-19 most often causes the respiratory systems that can feel much like a cold, a flu, or even pneumonia. COVID-19 may attack more than your lungs and your respiratory systems. Other part of your bodies may also be affected by the disease. The word corona means crown and refers to the appearance that the coronavirus gets from the spikes, proteins sticking out of them. These spikes proteins are important to the biology of this virus. The spike protein is the part of the virus that attaches to human cells to infect it, allowing it to replicate inside of the cell and spread to the other cells. Also, some individuals are more likely to be seriously ill than others, and that's because of what age category they belong to. It affects elderly more than it can affect younger people, but that also depends on what underlying diseases they have, such as a cardiovascular disease, diabetes, chronic respiratory disease, or even cancer. The problem then occurs as an emergency treatment is often more expensive than that the uninsured or uninsured cannot afford it and just not to pay. This means that the hospital will have to take responsibilities of the charges, and this can affect the financial aspect of the hospital and their budget. Getting support from leaderships from the health department, like you guys, a coalition or organization for conducting the assessment and creating a plan of action would be the first thing that I would want to do. In a crisis such as this global pandemic, we will be able to create challenges for data collections and agency to process, such as a community needs assessment for community action agency, which affects an impact data collection method, response rates, analyzes, and prioritization. Having survey questions regarding COVID-19 sent out to the communities would be the start. The survey question would include a person's ethnicity, age, and medical history. By doing so, we can gather information on what household is mostly affected by the virus. To protect themselves and those around them from the spread of COVID-19 in a populated neighborhood in marketing settings, individuals can use personal controls such as masking, physical distancing, and ensuring proper ventilation. For this to be accomplished, a facility or a care center should be established to where someone is a healthcare worker, of course, such as a nurse, a physician, can set up a class so that he or she can educate the community regarding the virus and how to help spread the virus. Healthcare centers, pharmacies, and grocery stores should also have a good number of supplies of masks, amongst other things such as sanitizer and cleaning supplies, to help spread the virus. Governments and organizations can also promote and enable proposed controls by enhancing policies and providing resources. Applying preventative measures that includes physical distancing, mask wearing, and clean hand hygiene, as well as cleaning of touch surfaces in density populated areas and markets, such as mitigate of the spread of COVID-19. Getting vaccinated and tested is another way to help stop the spread. Offering free vaccinations and testing at a local pharmacy, or making or building these small clinical sites, is a great way to help the community. Also, if you're over the age of 65 or unable to work, or if you're unemployed, these people are eligible to receive a free cost health insurance situation through the government, which is called the Medicare program. Individuals or family that are considered low income can apply for a similar type of government health insurance known as Medicaid. For an individual to learn how to assess these information, flyers or letters along with the website and a step of directions on how to acquire a healthcare insurance can be sent to an individual's home's address. And for those who do not have a pop-up clinic, they should be able to set up so that everyone is able to stop by and get help. Like having a drive-through clinic at a empty park lot would be another idea, to where an individual can drive up, get tested, give them a pamphlet on how to fight this virus. So hopefully with this proposal regarding a relief program for COVID-19 and building more healthcare facilities and small clinics to this community would go through with you guys. And thank you very much for taking the time to listening to my proposal, and hopefully you guys are with me on this one. Thank you.